Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
I feel great.
Wonderful. So today we're asking the question, what is the difference of a filling versus a crown?
Job of a filling and a job of a crown. A filling is to take care of a little tiny hole or a mild to moderate sized hole that fills less than 50% of the chewing surface of your tooth. Dentists, by nature, are too conservative, way too conservative. And primarily because the patients say, hey doc, can you just fill it?
Sure. They want to say, yeah, want to help you out.
Because we're addicted to yes, and we need to say yes, and we want you to say yes. So we say, sure, let's do that. Yeah. And then the filling gets too big. It's greater than 50%. And then I get a phone call maybe a week later. I'm sensitive. I can't chew on it. Okay, and then we say something like, hey, maybe you need a crown. So I'm guilty of that. I'm not perfect. We try to give the alternative options. Hey, Jackie, this filling is really big. You really need a crown. And we want to put a crown on this tooth is because more than 50% of the chewing surface is gone.
Yeah.
Either due to an old filling, a fracture, or a cavity, new cavity. So let's save this tooth from a root canal and put a cap on it, which is the term most people use. We call it crowns. And if you choose to do so or not is based on what it costs. If you have insurance, if you don't have insurance, but if all things were held equal or they're free,
right,
you would choose the crown because hopefully you would want to avoid the loss or potential loss of nerve or tooth if you don't do it in the right sequence. So we end up with the fillings a lot of times, and our patients are pretty cool with it because we do spend enough time. And like I'm explaining to you, I would explain to the patient, listen, I know you're going to call me back if it's sensitive. We're probably going to tell you need a crown on it because it's 75% filling and 25% natural tooth. We had to put a little pin in there to hold it, which compromises the tooth health, and you could be back.
So the job of a filling is to fill in this hole. It's got to be less than 50% of the tooth's chewing area. And if it's more than that, your best bet is a crown because it's built for the long term. You're not going to have to come back, pay again for something else. And you're definitely going to avoid a root canal, which is a harder procedure, more painful. When you lose that nerve or if your tooth dies out, it's going to be a really painful experience, much more so than the small filling.
Especially for moms. And we always say, don't mess with mom's schedule. Mom, look, I really recommend a crown on this one because you're picking up Johnny and dropping off Susie simultaneously. How you do it, I don't know. I think we just do this right now and get it over with.
Yeah.
And then you choose.
So Dr. Bilski at their office, any of the doctors you see, they're going to give you the right options. They're going to lay it all out there for you, communicate well, and let you decide with them what is the best solution for your needs. So if you're not sure what you need, if you're experiencing pain in your tooth, if you think you need a filling or a crown, you need to call their office, schedule an appointment. The best way to find out is to get an assessment. So give them a call today at 216-524-4410 or visit them online at bilskidds.com. You can also drop by their offices right off of Rockside Road in Independence. Thank you so much, Dr. Bilski.
Thank you.